Good evening. Thank you for tuning in to Face to Face. I'm your host, Dennis Ward. Our guest this week is Dr. Cindy Blackstock. She is the Executive Director of the First Nations Child and Family Caring Society, a professor, a member of the Gitxsan First Nation, and a lifelong advocate for Indigenous youth. A little more than 10 years ago, Dr. Blackstock, along with the Assembly of First Nations, filed a complaint with the Canadian Human Rights Tribunal against the federal government. Last year, the tribunal ruled in their favor and declared, yes, the Canadian government does discriminate against First Nations children living on reserve. Cindy, thanks so much for taking the time to join us here on Face to Face.
No, it's my pleasure to be here.
As I mentioned, it's been more than a decade since the First Nations Child and Family Caring Society and the AFN filed a case with the Canadian Human Rights Tribunal. What were some of the factors that led up to that case coming forward?
Well, I think like a lot of other issues, this case was brought as a last resort. We had worked with the federal government, meaning the Caring Society, Assembly of First Nations, and First Nations child welfare experts from coast to coast to coast for 10 years preceding that complaint. We'd actually developed 2 reports jointly with the government that had recommendations on how to ensure culturally based, needs-based and equitable services for First Nations children and their families that help them to be able to stay together so that there isn't the overrepresentation in child welfare, and how to properly ensure the implementation of Jordan's principle so that children are not being denied necessary services, any public service that's available to other kids. So we did those recommendations in good faith. The federal government ministers sent us letters saying with a great work, and then they didn't implement them. And the price of not implementing them was horrifying to us. We reached really kind of a critical tipping point where I remember reading a document that said during the time we were sitting at that table, the number of First Nations children going into child welfare care increased 71.5%. So sitting at that table and talking to a government that's not really serious about acting has a price, and it's paid by the children. So that's why we went to the Chiefs Assembly, got the resolution in 2006. And I know then National Chief Phil Fontaine actually went to the minister hoping that they would come to their senses after the resolution is passed. They didn't do it. The case was filed, and within 30 days, AFN lost all of its child and family service funding, and we lost all of our core funding. And that's okay, because that's our job as adults, is to stand up for kids. I would do it all again in a minute.
Did you see that funding cuts as some sort of payback for what you were doing?
Yeah, absolutely. Like the timing within 30 days and for both of us was clearly, to me, related to that. We could never prove it in any government documents. But later on, as we know through this case, the retaliation continued, and eventually Canada was found responsible in the Canadian Human Rights Tribunal for willfully and recklessly retaliating against me for this case.
We're talking about 160,000 plus First Nations youth here, but were there specific cases that stuck out to you at that time that you said, look, we have to take this to the Canadian Human Rights Tribunal?
You know, I talked to youth in care and youth who were out of care, who have grown up in the child welfare system, and they often have one key recommendation, which is, why didn't you support my family so that I could stay at home? Things weren't perfect there, but with the proper supports, I could have stayed there. And instead, I was removed from my family, and I undergo about 10 to 20 placement changes. Like, that's no childhood for kids. So that was really key in it. The story of Jordan River Anderson, like, he was a huge, and continues to be a huge inspiration, he and his family, about why this little boy suffered in a hospital for over 2.5 years because governments argued over who'd pay for his at-home care. It was tragedy, one tragedy after another. And then as the case unfolded and Canada fought it on tooth and nail on legal technicalities, we started to hear of more cases. And they would actually be documented in the government records. And I can't even really have a word for it about how horrifying it is to see how normal they would write these things. Like, there was a little girl, she's 4 years old. She goes in for dental surgery. Something goes horribly wrong. She needs some breathing equipment so she doesn't suffocate. And it goes through the hands of over a dozen bureaucrats. I'm sure these are good people, but for some reason the system just allowed them to pass this case from one person to another, looking for authorities in the government, before someone wrote on there, absolutely not, we're not going to provide that. You know, there was other kids where they were having to rewash feeding tubes. Parents were having to rewash feeding tubes because the government of Canada said, no, you can only entitled to this many. And the children were terminally ill. And we saw kids going into the government records themselves saying, our funding is so inadequate. They called it dire, creating dire situations, that we're driving First Nations kids unnecessarily in child welfare care. And there's this grid, and still see it in my mind's eye, where it was plotting the risk to the government if a child should die. And the risk of a First Nations child dying because of the underfunding and child welfare was extremely likely and very, very probable. So it was like they knew this stuff, and yet the face of the government in terms of its action was all about fighting these children and their chance to grow up in their families. I find it just unbelievable.
For a decade, they fought this, and the back and forth carried on. And so did you see conditions continually, year over year, continue to deteriorate for First Nations youth?
Yeah, you know, and there's lots of research to say this, but we don't even have to go there. We can just understand it as people who are in the communities, where if you see a family that's in crisis and they aren't getting those culturally based supports that they need, things are not going to get better. They're probably going to get worse, and worse for the children. So the children get more needy as they go along without these supports. And some of them sadly start to internalize the inequities as being something about them. And I think that really is a key contributing factor to the high rates of youth suicide we see across the country. When First Nations children are deprived an equitable chance to get a proper education, they live in communities where there may not be any water, there may not be any sanitation, they're not given the supports to deal with the multi-generational impacts of residential school. All of that creates a perfect storm around a young person. And young people, just by nature, take anything that's happening outside of them and internalize it. They think they're the problem. And that's a huge problem for us in First Nations communities. It's known to the government too. The World Health Organization in 2008 did a whole study on the impacts of inequality. And the chairperson of the WHO at that time, the World Health Organization, said inequality is killing on a grand scale. And it's still killing in Canada.
Dr. Blackstock, this seems kind of incredible to say, but during this time when you're fighting the federal government under the Harper Conservatives, the federal government was literally spying on you. How did that come to your attention, and what were your thoughts when you found out that this was going on? Well,
I'd heard rumors about kind of federal misbehavior regarding me, but I didn't let myself be detracted from it. It all came into sharp focus in 2009 when I was invited by the Chiefs of Ontario to go to a meeting at Indian Affairs headquarters in Ottawa as a technical advisor. Now, that's not unusual, right? So I go there, I clear through the security stuff, I go up with the Chiefs of Ontario. Long story short, the Indian Affairs official there refused to allow me in the meeting. They said if I went into the meeting would not happen at all because I had all these concerns about them. And I said, well, I'm not there to talk about the tribunal. I'm just there as a technical assistant for the Chiefs of Ontario. The Grand Chief then of AIAI, Randall Phillips, said, yeah, that's all she's here for. That wasn't enough assurance for them. So I actually voluntarily sat outside, and they had a security guard about over 6 feet, over 200 pounds, this guy, guarding me during this time. And I'm thinking, like, this is as violent as I get, right? Like, I mean, really? What is it about a social worker who doesn't even have a parking ticket that gets that kind of response from Indian Affairs? So I did a privacy request, and that's when I got all the documents showing the surveillance.
What was the impact on you personally, finding out that your own government was, keeping tabs on you, building a file on you, over the fact that you were trying to get equality for First Nations children?
I remember the day when I got that disc in the mail from the privacy and access folks, and I fired it into my computer. And, honestly, I didn't think there'd be anything on it other than public news stuff, right? But when I started to see snapshots of my Facebook page, the fact that they had taken detailed notes of a talk I'd given in the middle of the desert of Australia, what really disturbed me the most was that they were actually taking the URLs of people who were communicating with me and identifying these people, right? And the comments that they would make through the emails about the surveillance. And I'm just thinking to myself, this is Canada. This is a democratic country. This is what they do when they're confronted by someone who is saying that there's something really wrong happening in our society and we have a chance to put it right, is that they target that individual, and then they also, through the process, look at people around you in your circle as a mechanism probably for intimidation. It was shocking to me, but it absolutely wasn't going to stop me.
Do you think that surveillance continues today?
I don't know that it's not continued. The government was asked to sign a legal undertaking to say that it stopped after the legal ruling came down, saying that they willfully and recklessly retaliated. They refused to sign that. So who knows?
Dr. Blackstock, we have to pause for a quick break here, but we'll be right back to continue our conversation with Cindy Blackstock here on Face to Face. Welcome back to Face to Face. Our guest this week is Dr. Cindy Blackstock, a lifelong advocate for Indigenous youth. And before the break, we were talking about how the former federal government, or the federal government under the former Harper Conservatives, was spying on you at a cost of millions of dollars, I understand.
Probably millions of dollars. What I do know is that at least 189 different high-level public officials in Department of Justice and Indian Affairs were involved in this. So if you think about the payroll there and how that money should have gone to children, like instead of following me around, they should have actually been doing the right thing and providing mental health care and supports to families and all those things that are so needed, right?
And you won a case that you filed with regard to that surveillance and spying. Yeah,
the Canadian Human Rights Tribunal in 2015 found that the Canada's behaviour was willful and reckless retaliation and awarded me $20,000 in damages.
We're talking about, right now the former Conservative government and the lead up to the Human Rights Tribunal decision. The country was in the middle of a federal election. The rhetoric coming from the Trudeau Liberals at the time was of nation-to-nation relationships and things were going to be better for Indigenous people in this country. Were your hopes high at that time that things were really potentially going to change for First Nations youth?
My hopes were high. I always like to believe in the goodness of people. But I also was realistic because the Liberals were in power for many of those years when we had done those joint reports leading up to the tribunal's filing, and they hadn't implemented those solutions. So I was very worried that there would be lots of positive symbols and language in the signing of working tables, that really, all that kind of stuff, but things that don't make a difference for the actual children on the ground. And so I remember the night that we got the decision, and it was public, and I was responding to some of my friends on email, and I said just that. I said, I'm happy, but I'm also really worried. I'm really worried that things won't change for the kids and that we're going to have to keep fighting. And that's what happened. There was some relief for you, though, after 10 years of battling this thing? Yeah, for the decision for the children was just enormous for me, right? To realize that they had been heard, these children and their families had been heard by the tribunal in such an important way. When I opened the decision for the first time, and I got it a few days before anybody else did, and it actually comes unceremoniously on my iPhone, right? I was at a graduation party, and everything went silent. Like it's one of the few moments in my life where time itself stopped. I couldn't hear anything. I just felt like I was in a suspended kind of reality. And it took me a moment to kind of press that button and see what was there, because I knew that the well-being and the safety of 165,000 children, their families, and all the descendant children that are going to follow, their fate was bound up in whatever was in that decision. And when I pressed it, and the first line is, this decision is about children, underlined, I knew it was going to be good. And the decision itself is beautifully written, in that it acknowledges the struggles of residential school survivors and how their courage in telling the stories has educated other Canadians, but the government has not reformed its internal systems so that it stops the removals. And that's the big piece. When people talk about child welfare reform, sometimes we don't look back at Indian Affairs and say, How did you change your system? Like when I met with an Indian Affairs official, high official, shortly after the decision, I said, I have a question for you. What did you learn from the decision? And how has that changed the way that you think, act, and feel at Indian Affairs? And all she could say is, that's an interesting question.
1 year, a little more than 1 year now since that ruling came down in your favor. What's changed for First Nations youth in this country since then?
Well, Canada, of course, relied on Budget 2016, right? Remember the big fanfare around that, and this is a historic budget. And we were pretty concerned because between January 26, when they were ordered to immediately cease the discrimination, and when Budget 2016 comes out, they did nothing, right? So this was supposed to be the linchpin for them, the actual compliance. And it was $71 million. And, you know, Dennis, I've been doing this like for 30 years. I had never seen a pegging of the shortfall that little. Even in a conservative government, it was at least $108 million. So how did they come up with $71 million? That was my first question. And then when you take a closer look at it, you realize that the feds are hiving off $10 million of that for themselves, right? So there's only $61 million actually going to kids. So that's far short of what I felt was needed. Just immediately, just to take the sting off it, not to deal with the full breadth of the discrimination, I thought at least $216 million plus money for Jordan's principal. So that was less than a third of that figure. And they kept on making submissions like we're making good first steps, we're discussing things. Well, it wasn't until September 30th of 2016 that they finally admitted that Budget 2015 was developed months before the tribunal ruled and never altered since that time. So really, this was business as usual for the department. When it comes to Jordan's principle, they did nothing until July. And then they announced a definition of Jordan's principle. It was so narrow. They said it would only apply to children with critical needs and short-term disabilities. Why? I said to them. You know, why do First Nations children only get equitable access to all public services if they're critically ill for a short period of time or if they have a disability? That doesn't make any sense. It didn't make sense to the tribunal either. So there's these two non-compliance orders. And finally, Canada's at a point now where it's at least verbally saying that it applies to all public services. But just this past week, we've been working with a family where that mom is being denied an equitable amount of catheter tubes to make sure that her daughter has the proper supplies. Like, why is this still happening when the tribunal ruled a year ago? We had other non-compliance hearings in March. And I think one of the starkest examples of the non-compliance is actually the deaths of the two girls in Wapahika First Nation from suicide. What a lot of your viewers may not know is we talked a lot about mental health for youth in the tribunal hearings itself, and it's part of the order. What came into evidence is that for non-Aboriginal children in Ontario who are at risk, they get mental health services. But the feds knew about that, but still didn't fund it for First Nations kids. When they had to do their first compliance report to the tribunal, the federal government said they're prepared to discuss providing mental health services, not actually giving them. And then we have the First Nation in July hearing about the suicide pact of the young children, asking for help from Health Canada. Health Canada doesn't respond. And then we have the deaths of the kids. And then in sworn affidavits to the tribunal, one of the physicians that serves that community and is also an acting coroner for that area said those deaths were preventable, had those kids been given those services. So Canada doesn't kill these children, but it creates conditions where their deaths are far more likely.
This is a very important topic, and I hope to delve into that in just a few minutes. We've got to take another quick break here, and we'll continue our conversation with Dr. Cindy Blackstock here on Face to Face in just a few minutes. Welcome back to Face to Face. I'm Dennis Ward. Our guest this week is Dr. Cindy Blackstock. And Cindy, before the commercial, we were talking about some of the impacts in terms of mental health. And do you think this discrimination that the tribunal said is happening, discrimination against First Nations youth, is there any doubt that that's playing into some of the hopelessness and the suicide crisis that we're seeing in many communities?
No, I don't think there is. I mean, in two ways. One is, like we talked about earlier, where when you're a young person and you're dealing with all these inequalities, you don't know that Ottawa's underfunding you. All you see is other young people off reserve in other communities doing a lot better, and you're struggling. So you internalize it, making it far more likely that you're going to experience mental health issues. And then that's how the second thing comes into play, where there are insufficient culturally based suicide prevention and long-term supports, not just for that child, but for the whole community, in order to promote wellness and to avoid youth suicide.
Dr. Blackstock, we talk a lot about the youth here, and as we should, but this has been a long battle for you, and as we mentioned, the government spied on you, followed you around. What has been the impact of hearing these stories, going through these court cases, been on you personally over the past decade and longer?
There's been times when it became very difficult to believe in the goodness of people. I saw those PowerPoints about how they'd rationalize the denial of service. And I looked at that and I said, that's racism on a PowerPoint slide. And so those feelings of anger, those feelings of sadness, of disappointment, they were all things that I felt. Sometimes even a little bit of hopelessness. But then I would just spend time with the children and the families themselves. And they were my constant source of inspiration. I would go out to the communities and I would see these children and all the light and hope in their eyes, and how kids like Shannon Kustachin, another great influencer in my life, she didn't just become overwhelmed and swamped with the lack of a proper school in her community, the lack of potable water in her community, and all these things. She said, I am going to do something about it, and she did. So I always centered back on those kids. And I thought, you know what, as an adult, I have one real role in life, and that is to stand up for kids in ways that make them proud. And so I'm not going to be cowering under my desk or moping around when I actually could be working in the company of these children, their families, their leadership, and many non-Aboriginal allies to do the right thing. So, like, for example, with the retaliation money, I did not take that money personally. I don't want that money. We used it for children's causes, so we donated to children's causes, and we had used thousands of it to actually host a celebration party for all of the First Nations and non-Aboriginal children who had come to the tribunal hearings. So we had a big lunch with music and with songs and with kids talking, and we thought the proper place to host that was right inside of Parliament, so that's what we did.
Well, I'm glad we could end on a bit of a high note. I wish we had much more time for Dr. Cindy Blackstock today. We thank you for the work you do. Thank you for joining us here on Face to Face. Unfortunately, that is all the time we have for today. We're always looking for new guests, so if you have any suggestions, please email us at news@aptn.ca. Thank you for tuning in to Face to Face. I'm Dennis Ward.